The Texas Cardiac Arrhythmia Institute is a sort of a structure under which physician, nurses, and technician, researcher work together to try to improve the care of a patient with rhythm disorder.
It's a rapid rhythm in the upper chambers of the heart that typically beats about 300 beats a minute. We understand that it begins in most people in the pulmonary veins, which are the structures that bring blood back into the heart from the lungs, and typically causes symptoms of rapid palpitations, shortness of breath, easy fatigability, and a general feeling of malaise.
In the fall of 2010, I started noticing shortness of breath and some lightheadedness. I went to see my primary care physician. He sent me to a cardiologist who recommended I see Dr. Gallinghouse at St. David's.
AFib was, one is I felt, the first indications to me was that I felt palpitations at night when I was lying there. I just felt like something really wasn't right.
The patients that we follow are the patients that have atrial fibrillation, or currently we call it AFib for short. When you have atrial fibrillation, your heart is not in sync. The top chambers and the bottom chambers are not in sync with one another. Some of the symptoms that we see patients present with is fatigue, exercise intolerance. Occasionally they'll have some chest discomfort or chest pain, depending on how fast their rate goes.
When I had the lightheadedness issues, I'd be sitting down most frequently, and just kind of out-of-body experience where the room was kind of twirling around, and it would pass after 15 or 20 seconds, but it was enough to scare me into go seeing my primary care physician.
We have several tools now that are specifically designed for the treatment of arrhythmia in this way. We perform a procedure called radiofrequency ablation. Several technologies are brought together to allow us to do that. We have very advanced three-dimensional electroanatomical mapping systems that allow us to see exactly where our catheters are positioned in the heart. We have special ultrasound cameras that we can put into the upper chambers of the heart to see where our catheters are located. And then we have special catheters, the tip of which can be heated, that allows us to essentially cauterize the tissue around the pulmonary veins and electrically isolate those veins and wall off that bad electrical activity that's causing the AFib.
Some of the improvements that patients report to us after they've had an ablation is that they've gotten their quality of life back. They're able to start working in the garden, running. We have a lot of people that are marathoners, and we've given them that back where they can start training for another marathon, or just strolls through the park where they couldn't do that before now, or traveling. They're able to get back to their normal routine.
I'm happy I had this procedure done. I was nervous going into it, but afterward I felt better immediately the next morning. I went up and was walking around the halls less than 12 hours after the surgery, and that amazed me. I was thinking it was going to take me a while to recover. Really, I could have went back to work after 3 days. They suggested 5. So I took the time. The recovery process, there's nothing to it. Everything goes right. You're in constant contact with your doctor's nurse. Highly recommend it. I'm able to work out again without the shortness of breath when I'm doing cardiovascular exercise, able to enjoy things like going to the park with my dogs, again without the shortness of breath issue. So overall I just feel really, really better.
When I hear St. David's here in Austin, I feel that they give you the best care that you're going to get.
If you feel anything at all, whether it's a skipped heartbeat, whether it's just a quick moment where you feel like your breath is being taken away, or even a little chest discomfort that you want to say is just indigestion, always, even if it's just going to your primary care physician, go in, get an EKG, get it checked out, and then come see us. We're here to take care of you.